Hello, everyone. Dr. Anna Kabeka here, the girlfriend doctor. I'm here with a girlfriend, Miriam Rahav, Dr. Miriam Rahav. It is great to have you here with us. She is in the midst of coronavirus epidemic in New York City. She has an integrated practice, a group of amazing practitioners that she works with, and she has been doing so much outreach as well as battling on the front lines. Miriam, how are you? Welcome. Thanks for joining me today.
Much. It's so great to be here, and I think spread as our intention is a message of hope and empowerment, and what we're really able to achieve in the outpatient setting.
Let's talk about that. What is going on there in New York? What's been happening? What are you seeing?
So I think what we're seeing on a daily basis is a little bit different from the mainstream narrative. I mean, one of the things is that each of us is profoundly affected. Just our physical surroundings are very changed. The streets are empty. People are sheltering in place. It looks like it's a very surreal feeling to be living here in New York, which is, the city that never sleeps, and to have it look the way it looks. I think that's affecting everyone profoundly. And then the numbers, if we follow just, let's say the New York Times is with this ongoing kind of tally of the numbers. I'm also reaching out to colleagues that I trained in, colleagues who are intensivists, hospitalists. My own specialty, in addition to internal medicine, is hospice and palliative care. So I'm reaching out to some of my colleagues in hospice and palliative care, and the story that they have to tell is pretty devastating. And so I think it is very different what we're seeing here in our clinical practice. We are seeing people who are indeed very, very sick. There seems to be, in terms of maintaining hospital resources, a qualification for hospitalization in terms of oxygen saturation, where it needs to fall below the 90%. So we're able to see people kind of hovering just above that with malaise, with shortness of breath. A lot of myalgias and bone pain is another thing that people really describe. Fevers precede that. A lot of nausea and loss of appetite a few days into symptoms, and just a generalized weakness. Some are able to make it in, some have been carried in, and for some, pending our staffing, which is also a little shorter than usual just because of logistics. Public transportation has shifted also the ability for people to get into our office, staff included. We are doing outreach to people's homes. Our nurse practitioner, Danielle Alicio, has been an absolute hero, just grabbing her car, mixing up bags, doing, if appropriate, clearance via telemedicine for first-time IVs or directly at the patient's home. And we've been able to care for either decompensated, meaning not able to walk, or elderly and afraid to leave home. With some of our octogenarian rock stars have gotten treated that way. So, and we're seeing across the board huge clinical improvements, not always across the board. For example, with some older people with a double pneumonia and desaturation, we're seeing that it might take more than one treatment, but huge clinical improvement after one treatment, sometimes near resolution, or we can pick up with some of the supplementation that we can discuss, or people might want to know what are some of the tools that we've been using successfully. And then that one IV has been enough to kind of get them back on their feet and get them into an oral regimen. And then people are really thriving again.
I think this is awesome. I did a lot of IV therapies in my clinical practice, and using IV therapy, it's on standby right now. And Lucian, we'll talk about that in a second. I just kind of want to review some etiology. There's always the question of what makes coronavirus different than a regular flu virus. And I think what's interesting, it's a coronavirus because it has, when we see the images, all these spikes that allows it to attach and to get into our cells and do the damage that it's doing, creating the cytokine storm. Most people, it looks like 88% present with a fever, 68% present with a cough, 38% fatigue, 33% sputum production, 18% shortness of breath, 14% sore throat, 14% headache. So in addition, about 5% vomiting, 4% diarrhea. Is that what you're seeing too?
Yeah, I think they might be seeing, I think some people who are managing at home might have more mild. I'm seeing a lot, I think, for people who are actively coming, they haven't been able to kick it on their own. And so I think we're seeing kind of a sicker people who are struggling more with shortness of breath, huge amount of myalgias. A lot of people are describing just pain into their bones, just a bony pain. And speaking to the pathophysiology of that a little bit, seems to be related to that structure of the virus and where it attaches actually to the heme molecule, kicking off iron, and therefore not the heme molecule rendered ineffective in terms of oxygen transport into the body. And so when people are describing these myalgias and pain, it's almost like it's kind of a low level, but ischemia.
I heard compared to altitude sickness.
Yes, exactly. And that seems to be the pathophysiology. Along with that, we have these dissociated iron molecules who are now acting as free radicals, kind of inducing this inflammatory response, which seems to be systemic and bilateral, which is why we have radiological imaging showing these bilateral processes in the lungs, especially in the lungs, which is where the iron is dissociating. So, and overwhelming the body's ability to quench that inflammatory response. We're seeing that with people with pre-existing, like, so let's say, which is something that might be more routine in practices like ours, where we screen for mercury, arsenic, aluminum, and lead, and get a little bit more of a sense of what's happening environmentally, is that people who seem to already have a pre-existing load or lower oxidative defense, antioxidant defense, preceding getting infected, are those who are going to manifest more severely.
That makes sense for sure. I want to welcome our viewers that are coming on, and guys, be sure to share this, tag your friends, bring them along. We can ask both me and Dr. Rahav questions. She's in the midst, if you're coming on just now, of the pandemic in New York City, and so she's practicing there. Dr. Rahav, I'm glad you're there. My 89-year-old aunt is in north of Manhattan, and or just in the north part of Manhattan, wherever that is. And I'm glad you're there. So, we need you. She's been doing well, staying in, and doing precautions, which is our number of best defense, right? Precautions. And so to talk about some of this pathophysiology, how it's affecting the iron, is that possibly why the high dose vitamin C is working well?
Yeah, I think so. I'm trying to think and meditate. I think it's more than one mechanism of action, because we know that lower dose vitamin C, right, which is what's being recommended for most people to maintain at home. So we recommending up to 2,000 milligrams of oral supplementation a day in divided dosing, because there's only so much that we can absorb at a time. So if we can do that in 500 to 600 milligram quantities and try to pulse that throughout the day, where we have whatever we have in stock right here as 600 milligrams. So we're saying try to get 3 or maybe even 4 of those a day to maintain your antioxidant defense. We know that vitamin C at higher doses actually is also has a pro-oxidative mechanism of action, where it actually seems to pool around the cells, and the body can convert to hydrogen peroxide, and then actually increases oxygen on a cellular level. And I think we're dealing, and I don't know that we've completely wrapped our heads around all of what works, including hydroxychloroquine, which we can maybe touch on again, because I think it also touches on this whole idea of the pathophysiology of COVID-19 and what's happening at the level of the hemoglobin. And but in any event, I think it might have more, because I think the alveoli, which normally have surfactant with vitamin C, I'm sure some of that's being pulled into the antioxidant defense against those dissociated iron molecules at the level of the lung. And then also this other at higher doses, we know that increasing oxygen tension in the body, like the mechanism of high dose vitamin C in its applications in clinical medicine at higher doses, for example, as a complementary treatment for cancer, is actually working to kill the virus directly, right? So we know that all of the bugs that affect us, be they bacterial, be they spirochetes, be they viral, are all anaerobic. And that's actually a strategy that we've used clinically to address viral illness routinely in our practice. And so routinely in our practice, we've used IV therapy to address viral illness, used it for influenza virus, used it for post-herpetic neuralgia, used it for shingles, so that when COVID became clearly a clinical entity that we would need to be contending with as a practice, we all sat down and said, hey, we've dealt with viruses. Yes, there are exceptions or specific pieces about this virus. I think foremost is that it's novel and our immune system hasn't seen it before. On the one hand, that we can adapt ourselves to treating specifically. And I think that is a huge dialogue in the scientific community. And a work in progress in terms of understanding, the pathophysiology and what specific points we need to address in order to prevent and treat COVID-19 specifically. But then there's how you deal with viral illness and how do you support an immune system in general. And that was, preliminarily our conversation. Like, we as a practice have been able to treat people effectively for these conditions, and vitamin C is one of those tools, but that was a tool that was also validated by colleagues around the world. So that was the tool that we chose to lean on, the most validated tool, in the true spirit of scientific inquiry and kind of pooling our collective wisdom.
So in addition to the high dose vitamin C, are you using 15 milligrams, 20 milligrams, or 20 grams?
That's a really fantastic question. And so we started with using what is generally empirically kind of the highest within safety margin. If we don't have the ability to check for G6PD, if that's just for our listeners, and forgive me if I lapse into medical lingo, that's an enzyme deficiency that's more prevalent in people of Mediterranean origin. But that's where, when there's higher oxidative stress, and there are certain things like high dose vitamin C, which is meant to be pro-oxidant, right? But in people who have an enzymatic vulnerability, might lead to stress at the level of the red blood cell, and for that red blood cell to burst. And when we call that a bursting of the red blood cell, we fancily name that in medicine hemolysis, or the breaking up of a red blood cell. And then if our red cells are broken up, we don't have enough to go around, and we call that anemia. So G6PD deficiency can lead, under certain stressors, to a hemolytic anemia, which is obviously something that we do not want to cause. And so empiric dosing, we have dared and successfully used up to 20 grams of vitamin C empirically without being worried to cause, let's say in someone with G6PD, a hemolytic anemia, which I know is a concern of colleagues out there. And we experienced a lot of success with that. However, I will say there have been exceptions, because and not related to G6PD, but related to the overall kind of nutritional status and health status of the person in question, their kidney function, if someone is older and more frail. We've kind of scaled back from that 20 gram, which, just to translate that, if you're looking at your capsule of vitamin C at home, frequently a capsule will be 500 milligrams. So in an IV, I'm talking about 20,000 milligrams. So that's like a real significant dose. And we've used that, again, safely in practice over and over and over again in different clinical scenarios. But what we're seeing is that people affected by COVID might already be behind nutritionally and in terms of other comorbid or other health issues. And we're also seeing people newly, meaning they're people who are finding us who aren't necessarily established partners in healing of ours. And so we're erring on the side of caution. We also see that when those iron molecules go rogue, that one of the things that is happening is people's livers are getting burdened. As livers try to deal with the iron on laboratory, that means that we might see an elevated ALT. That's one of the liver enzymes, which seems to be a hallmark, a laboratory hallmark, along with elevated ferritin and a low white count and a low lymphocyte count. And so we are putting some other goodies into the IV bag. We're putting just a little bit of B complex, which supports the liver, some magnesium, some taurine, which is a safe amino acid that supports. And then we can finish off that IV with glutathione, which is our body's chief antioxidant, defense, and liver supporter. And we're finding that for people who are more frail or have other health conditions going on, that going down maybe to 10 grams instead of the 20 grams and using all of those other supportive nutrients. That means we might have to do it. Sorry.
You said vitamin C, 10 to 20 grams vitamin C, taurine, and then ending with a B complex.
Yeah, we're always buffering the vitamin C because vitamin C has an acidic pH, so we always have to put sodium bicarbonate in there, some calcium gluconate in there. What else are we? We're putting some trace minerals in there and some amino acids. Magnesium, magnesium sulfate. The sulfate is also helpful because our body really, we of course in our world study the different pathways of liver detoxification, but sulfation, of course. So we're getting like a 2-for with magnesium sulfate. Have I neglected any of our? I think that's what we're doing.
All in there. You've got a methylation, sulfation, glucuronidation, all in there. That's awesome. And so you make that cocktail. You end with the glutathione push. And that's where you're seeing these early symptoms of COVID improve, at least to a stance. I just want to stop a second and just say to everyone listening, I think some vital things to have at home right now are a thermometer. Okay, we've got all our toilet paper, we've got all our hand sanitizers, but a thermometer, a pulse oximeter, you guys can get from order or get from the pharmacy, a pulse oximeter to have at home. And that's another great thing, as well as monitoring yourself and seeing how you feel. If you're getting dehydrated, checking blood pressure, knowing what your resting pulse is, and kind of keeping track of your own vitals at this time as well is really important. So that's where you're treating the early symptoms, and then boosting our body's immune response, the body's natural immune response, which I think is really critical. We've had a couple questions come in. Ken Berry joined us. Hey, Dr. Berry, good to see you. And there's a question here. I got to put my readers on with my blue light blockers. Aceza said, have you tried to use higher doses of omega-3 in addition to vitamin C as an anti-inflammatory adjuvant?
That's a really beautiful question. In the past, I remember even before I kind of came through the pipelines as a practitioner with a practice where I was able to kind of work with IV therapies and different things. I remember actually a relative of mine developed shingles, and I used very high doses of omega-3s as part of that anti-inflammatory response. I don't think you can really go wrong with that. There's also a lot of plants that are naturally antiviral, and I think there's a whole list, and maybe we can pull some of the things that we're using in that regard. So I don't think it could ever be wrong to do, especially in an inflammatory response. We're also relying on some specific anti-inflammatory herbals that are also known to modulate interleukins in the inflammatory response at the pulmonary level. So we're using boswellia, and we're using cat's claw, seems to be one that people are responding really well to. Why not? Especially, I think also this is a time because we don't necessarily have all of these tools at home the way we would in a medical practice. So I would say, I forget the name of that user because I don't have it in front of me, but why don't you, what about the things that, oh, there it is, Aceza, hopefully I'm saying that right, that's a beautiful name, Nambasi. Using what we have, right? And so we can also think about our anti-inflammatory foods. I don't want to forget nutrition. What are the things that kind of keep our health in check? We know that quercetin is anti-inflammatory. It's naturally really high in onions, for example. So I was speaking to my beautiful community that I was with today, a few members of the New York Ecuadorian community who have this recipe that they kind of make this beautiful seasoning blend with tons of garlic and onions and spices, cilantro, tomato that they kind of mix into rice and mix into beans. Well, that's just a powerhouse of medicine right there. And kind of what are the things that are in our pantry that are also anti-inflammatory? Here in our practice, we have a herbal kind of tea pharmacy with beautiful herbs. And so, what do you have on your shelves that can be supportive? And just this is a time to really inspire you to kind of cook medicinally. We're also cooking at home. So what are those healing, restorative recipes that might be within your food tradition, or maybe another food tradition that you can adopt for the purposes of keeping yourself and your family both nourished and safe?
And I think that's a really good way to look at it. Our spice drawers, start really using our spice drawers. I mean, these herbs and spices were developed over the centuries. And I mean, think about garlic. Why did you ever start eating garlic? Well, because it's antiviral, antibacterial, antifungal. Using that in cooking makes sense and keeps us healthier, right? The ancient physicians, like, to the king, were the chefs who used to prepare the food. Right? That tradition goes way back to in Turkey, and I love hearing those historical stories, which is it's so interesting. I think and vitamin D, we haven't mentioned that yet, but we will. One thing I used to do sometimes in practice was injectable vitamin D when clients came in. Have you used injectable vitamin D?
Absolutely. So, I mean, I think what's happening now that's a little bit different from my normal workflow or our normal workflow, because I want to speak on behalf of my entire amazing superstar team, is that we have usually more evidence-based medicine. We're usually working less empirically, and we have a vitamin D level to work from. And so, when we have a low vitamin D level, we want to think about what people are doing, how much time they're spending outside, what their nutritional status is, or what their absorption is. So it's always a clinical clue when someone's taking vitamin D and their vitamin D level isn't going up, that we need to think a little more deeply about what's happening. It's kind of like you aren't what you eat, you are to a certain extent, but you are what you assimilate of what you eat. So we worry about assimilation and the various reasons that assimilation might be impaired. But the nice thing about an injectable form, especially when we're it's almost like a little bit of guerrilla medicine. People are coming in sick and we're like, okay, how do we pull them out of this crisis? But oftentimes when someone comes in and they're also just so behind the ball, we can give a little bit of B12. I think the other thing that we're seeing here is, especially when we talk about that kind of like that altitude sickness kind of manifestation, that low oxygen tension is how that affects ATP and mitochondrial function. So another way, I think, from our point of view, at least as functional medicine geeks, that we can think about is we think about the body's ability to make energy on a cellular level mediated by the mighty mitochondria. And so any dissociation of heme from oxygen and ability to carry that oxygen to the level of the cell, which is where oxygen is driving the process of making our currency of energy, adenosine triphosphate or ATP, is going to be impaired. So we're also thinking about, for example, we had someone come in today who was pretty decompensated, and we're like, well, what can we do to support their mitochondria? And we actually put some carnitine in the IV bag along with everything else. So, I think it's kind of like boots on the ground. What do we have in our own, it's kind of like our own pantry, our kind of injectable pantry, and what can we use to kind of support the human who's sitting in front of us, standing in front of us?
Yes, and just for our listeners too, carnitine is in red meat. You can get carnitine.
As is zinc, right? So keeping up amino acids.
For heat. Sorry. So I want to talk about that too. And also we had this great question, Melissa said, are supplements recommendations for prevention different from those for an active infection managing at home? Yes. Again, we want to boost our immune system. We want to raise we want to just make sure we fortified our foundation. So if we are healthy at home, thank God, detox, right? Clean up your stuff, get keto green. You hear me say that all the time. We want to create insulin sensitivity. So intermittent fast, extend, short extensions of fast, maybe not too long. Don't wear yourself out, but we just did in my keto green community. Those of you, I did a 5-day keto green fast with my community, and I ended with a 3-day water fast or modified water fast. So you want to work up just right now, just work on that intermittent fast. In Keto Green 16, my new book coming out May 5th, Miriam, I'll send you a copy. Yeah. It is 16 hours intermittent fasting, and then low carb, healthy fats, healthy proteins with 16 key foods to help with digestion and supporting the gut microbiome, which we have to get healthy right now to support our hormones, to support our immune system, our gut microbiome, these trillions of bacteria are our first line of defense often. So we want to keep healthy mucosa all the way through. You guys hear me say that all the time, like the vagina is an extension of our gut. I'm a sexual health expert, Miriam. I don't know if you know.
I know.
Was talking about this. So it is. So we want to keep our entire GI tract really, really healthy, and that's key. So now detoxing at home, detoxing off of sugar, right? Detoxing off any chemicals, processed food, chemicals, it's a lot more about what to let go of, and then use the healthy thing, the fresh bought, the fresh caught, those things. And it is interesting. When we lived in Holland, in the Netherlands, we did home exchange. We went around the world with my kids for a year. We did home schooling, and we did some home exchanges along the way. We were also in Israel, stayed with family there, but all around the world. And in Holland, in this home of six, a family of six, 4 teenagers and mom and dad, their fridge was so small. And I said, have no storage, no pantry. And they said, no, we just go ride our bikes every day to the grocery and get the fresh food, fresh produce. Mm-hmm. We have to, resort back to that as much, once or twice a week to the grocery store right now, because we want to avoid going. But that's an important thing. We want those fresh pieces as quickly from where it was picked into your body as possible, that maintains its nutritional content. So we can think of that. So we're going to self-monitor, let go of the things that work against us, all those toxins, all that sugar. We're letting go of that, and then really empowering our body, strengthening our immune muscle during this time. So doing the activities, getting outside, getting a good night's sleep. And really can't say enough about sleep, right? That is essential to empowering your immune system. And then baseline supplementation, so vitamin C, zinc. For my clients, it's Mighty Maca Plus. Who knows? I'm going to send you some, Miriam, because it has quercetin, it has turmeric, it has una de gato, cat's claw herb in it.
Oh, wow. Amazing.
From the Andes. Yeah. And 30 other superfoods, green tea.
Yeah. I want to speak, if you don't mind, for a minute, just like you inspired me with showing me the maca, is that I think also why it's so important for us to come together and tell the story of successfully treating COVID over and over again. Yes, bio-individualizing, is that a lot of what's happening is the stress. I know that for New Yorkers, I'm getting like really lovely and beautiful, well-meaning calls like, how are you doing? And for me, I feel, I'm heartbroken for what's happening to community of providers and to community of people who are sick. And of course, the death toll, all of that, it's real and it's incredibly heartbreaking and scary. I feel that I myself have not been scared because I've had the joy and hope of seeing these tools work over and over again. And so I think that's a huge message. But the corollary of that is the stress. I think that's part of why we're banding together, you and me, today, to tell the story of hope and empowerment, and that we can take back our health and we can effectively be our own best support, and that the tools that we can do that with are incredibly diverse. And I know that some people are afraid and then therefore not going outside. So a lot of the things that we know are good for health. And so I just wanted to share that one of we've been using, for example, the nano silver gel as a barrier method here in our office, on our hands and on our face. I think I might have a little tube to show
too, right? So nano silver, colloidal silver within your nasal passageways.
Yeah, yep, exactly. So we're snorting it up our nose, which is where we colonize. We're telling people to gargle, so that even if you go outside and you have your mask on and you're worried, okay, maybe I had exposure, what can you do to go home that will allow you, therefore, to go outside and not be too afraid to go outside and do the things that are healthful? And also, if we have limited access to groceries, I was thinking, okay, I'm buying as many greens, let's say basil, let's say dill, let's say, things that will keep, let's say it's a cabbage. I see that in the grocery store, things that people know how to make more frequently, like we know broccoli is good for you, but all the broccoli was sold out. So maybe this is an opportunity to go and pick up a green that you might not have cooked before. Maybe it's going to be a dandelion green, or maybe it's just going to be a purple cabbage, and you just chop it up if it's with dill, if it's with basil, if it's with cilantro, if it's with, oftentimes the herbs are more nutrient dense, and I'll put them in a bag and I'll wrap a little paper towel around it just to keep it fresher for longer, because this is like really a time for like food economy and for like having things go further. And so like if you're eating a chicken, saving the bones, add it to the broth, make like a beautiful, what can we do, and be creative. And if we happen to have herbs or access to herbs, then this is a time you can maybe pull it out and throw it in the soup pot. For example, slippery elm, is a wonderful, I think there's so much within the plant kingdom that we can use. Mushrooms is another big immune support.
Rosemary, the herb rosemary grows like a weed.
Rosemary is huge.
Okay.
Huge, thank you. Thyme is a huge lung one.
Yeah.
A huge lung anti-inflammatory. Is also amazing for the urinary tract. So, we could go on and on about that, but hopefully this speaks to just opening up your pantry and being creative and finding something that works, maybe discovering a new family favorite as a COVID silver lining.
Well, I love it about empowerment and strength, because honestly, that's what this is about. It is about getting our nation healthy. Our nation has been leaning back, getting sick, and giving away the power over their own body. The answer is not in waiting for a vaccine. The answer is empowering our health, getting us strong, doing what needs to be done right now, individual by individual by individual. Thank you. Thank you, Dr. Rahav. Really, thank you for being here, and thank you for sharing your wisdom and sharing your valuable time with us. We'll tell our audience, I know before you go, I want you to give some closing words, but also where they can find you, because you're doing all telemedicine right now, and then home visits for those that are in New York that can't get to your office there clinically. So share a little bit about how your practice evolved right now.
Oh, okay. So So again, I'm doing this as a team. We have an amazing front desk team. We have Rachel and Tiffany who sit at our front desk. And so thank you. That's such a beautiful message. Thank you, Jane. Blessings to you too. Oh my gosh, so heartening. And they're incredibly knowledgeable, and they're incredibly committed to being here. Like, we're all standing strong together and showing up every day. All of us have been affected. For example, one of our front desk people, her other family members, they've all lost their jobs. So it's her job that's also keeping her family afloat. And it's the grocery store that we luckily have across the street here, where there's still produce on the shelves that she's bringing home every day. So she's literally like feeding her family and supporting her family. And anyway, so you can call them there. All of us also, one of the things we did is that as we realized that this is something that we're going to stand up and not close our doors and try to stay open for as long as possible, faced with all the uncertainty that everyone else was also faced with. All of our appointments were canceled, and I said, whatever I have in my own personal savings or business savings to keep job security for all of us, that's what I'm going to do, and we're going to just stand up. And so we've been doing that, and each one of us also got just prophylactically IV vitamin C. Each one of us has silver gel and supplementation, and so they can tell you both personally and in terms of clinical experience if you want to call our office. And I said that you don't need to be a patient, and you don't need to be located here. Like, if you just want some suggestions, we're really here to stand as a community and be of support. This is not about who is or isn't ours, quote unquote. This is about being a global community and living a life in service to alleviate human suffering and be strong and help everyone be empowered. So you can give us a call just because, 646-503-5202, 646-503-5202. Ask a question, say hi, want a recipe, I don't know, whatever it is. We're really trying to just be here for everyone. And so that's from A to Z. That's from the two amazing women we have at our front desk. It's Danelle Alicio, who's actually the boots on the ground, getting in her car and going to people's homes, as well as our other amazing staff member, Ada Biko. And then we have me. And we're not a big team. This is also an opportunity for us to realize that maybe we need to grow our team. But we're located in downtown Manhattan, but I think we can really be a voice to support people all over the world.
Mm-hmm. And without a doubt, your knowledge, your clinical skills, your heart, right? Don't you guys love this woman? She is amazing. This doctor is absolutely amazing. So I'm just really blessed to have connected with you. So as part of like natural regimen that everyone else, we talked about it, right? We let them Keto green, wean off sugar. Let's detox, support your body immune system. In addition to that, hand washing. You know what's so interesting? I always think of whenever I say hand washing, Ignaz Philippe Semmelweis, Dr. Semmelweis, who way back when just said, wash your hands, right? Because the women in labor were getting infected from, you know, variety of reasons I'll go into another time. But anyway, just that wash your hands, like that simple thing is important. And then the colloidal silver, you know, as an extra barrier when we are expanding, but not to be afraid to do healthy activities. Yeah, show everyone how to go ahead and do it.
So it's like a clear water-based gel, and you literally kind of like, forgive me for just sticking my finger up my nose, but
awesome, we love it.
Snort it up there. And then the other thing that's really nice to know about this, and this has been an interesting crossover just into actually like it's a water-based gel, and it can go, it's literally like around and in my eyes. I've used this for my own, like if I ever get something in my eye, but my daughter actually really loves horses, and the horses in the summer, the sand flies jump into the horse's eyes and infect the eyes. And so we've used the silver gel in horses' eyes in veterinary applications just as successfully. I've also, speaking of women's health, I've put a blob of it on a tampon with like chronic yeast infection. And that's been really helpful. It's also great for like burns and abrasions. I sound literally like I'm a representative of the company, but it's been such like a pearl, like such a clinical pearl to have this tool and like a big fat tube of it that has lasted me like a year on my desk. It's going down a little more quickly now, but costs $25. So like, I mean, why not? So every single person in our, this is Silver Biotics. Oh, sorry. Silver Biotics from American Biotech Lab. I think the way they do it, it's called colloidal, but it's not really a colloid. It's a nanoparticle. It's an ion. And I think that is a misnomer that I just wiped. So it's attached to a water molecule. It's electrified. It goes in and out of the cell, and therefore doesn't bioaccumulate, because the argument I've heard against using silver is this condition where silver accumulates in the body, deposits in the skin, and leads to a blue pigment. And that's fancily known as argyria. Does not cause argyria. I know because I test. So I use photospectroscopy to test silver burden in the body amongst other metals. That's another functional medicine geek moment. But we know it doesn't bioaccumulate.
Yeah, and that's, again, a little bit goes a long way. And what strength is the question that you're using there?
Silver. Okay, so there are different parts per million. I think different products that I've seen on Amazon range between, like if you're just ordering it from Amazon, between 20 and 24 parts per million. I don't think there's a huge clinical difference between the two. So it's like whatever you can pick up. But that's a good question. You know, in terms of liquids that we take orally, I'm having some people maybe gargle with that. Again, I'm not sure the mechanism of action is the silver versus the electrification of the silver and the fact that it's ionic. Because silver has also been studied for this viral illness. So in terms of like gargling and getting at here, I'm using this as a barrier method, right? So a barrier method, because we know that the virus is going, like we're swabbing, we're going way up into the nose. So it's serving kind of as an antimicrobial barrier, also around the eyes. And I think the jury is still out in terms of what, again, like there's still, this is an evolution. So I just want to stay really humble here. And, but so far what I can say is that so far so good. If that's a fair statement to make, and that I've used in other clinical scenarios. In terms of liquids, it comes, or at least the preparations that I've seen, between 10 parts per million, which is usually used as kind of a daily immune system maintenance, to 30 parts per million, which is like an acute dose. But again, like it's hard to keep things in stock, so we're using whatever we have.
Yeah, and other brands that I've used are Silver Shield and Argentin 23.
Right.
And Silver Argentin 23 is one of my favorites. And they come in a spray, and
exactly. So it goes straight up, a nice nasal applicator. Mm-hmm.
Yes, and they have a nasal applicator. So that's another good option. I love them too. So this is fabulous. Thank you, Dr. Rahav. I know you've got clients waiting, but also what just a last word of advice for our audience that's watching, as you have empowered us and giving us all strength and hope, and glad you're there, and know that I'll do anything I can to help you too. So from Southeast Georgia to New York City, right?
Oh my gosh, I love you. And I really thank you so much for, first of all, for your lifelong work of just empowering humans, especially women, to be well, and, identifying reproductive health as an opportunity to support overall health, and how deeply the two are interlinked, and all those intricacies, like how incredible our body is. I guess the final message, or for now at least, that I want to say is that the body is incredibly resilient, and the body, if given the right things, has really such incredible healing potential. And that I think it's for us to just collect all the tools that we have, including community making, including calling people and just sharing love and support the way we're doing here. Like, I know my own heart is like swelling with gratitude for this opportunity to share what I do, and for you creating that opportunity for me. And so, like, I think there are things, like, I think in times of crisis, it often calls us to also, on top of everything else we say, just kind of expand our spirit field a little bit, and trust that we can and we do have the tools, individually and community-wise and as a planet, to really heal in a crisis. And then as far as like collecting those individual tools, we can support you. If you call us up and tell me what you have in your pantry, I'm sure we can put a good recipe together.
There you go. I love it. I love all of that. I think it's fabulous. And again, dig into that spice drawer and enjoy, right? Make it with love, the missing ingredient sometimes, right? The key ingredient, the most important ingredient. And I love what you said, Miriam. I take that to my heart too. Thank you. Thank you for everything you're doing, being here with us and sharing your amazing wisdom. And also, the integrity, strategy, and the leadership that you and your clinic is doing and providing right now, because I hope you're, keeping all this to write a research paper, because this is we'll need this again and again and again, right? We'll need to continue, not the coronavirus, something else down the line, but you are ready, prepared, you're boosting each individual's empowerment. And I honor you. I thank you for this. We're getting a lot of thank yous for this great presentation of hope and love for humanity. And I say that you're so right. It's for each of us, right? We talk about the exposome, right? That each of us, as we heal our own body, and that heals those closest to us, and that heals our community, and we heal humanity. Mm-hmm. And it is with love that key ingredient that increases.
Yes, oxytocin. I love it. Yes. Zinc, by the way, supports oxytocin.
What was that?
Zinc. I think zinc. But one of my concerns about sheltering in place is the loss of human contact. So because we know that just hugging and caressing and words of loving kindness increase oxytocin. So for those of us who have pets, we know that just when we're petting our pets, it releases oxytocin in us and them. And just hearing a little cat purr is just about the best thing ever.
Yeah, so true.
Hug your kids, hug the people you're still allowed to hug.
Yes, absolutely. Well, my house has expanded. We have a house full, 5 women, 2 dogs, all women. So it's been actually amazing. It's been amazing. I'm feeling the love. And so thank you for your heart to serve. Thank you, everyone who is watching and viewing today. Check out Dr. Rahav. I put her website link in the comments, so that's there. You can also just Google her name. And she's in New York, and she's available, and her team is amazing and on the forefront with adding integrative therapies and a science-based approach to really tackling the situation that she's faced with, and with hope, strength, and courage. And all of you are that for each of your families. You are that for you. You are in charge. You are the CEO of your body. You are your own best physician. Trust your intuition. Do the next right step today. If you're feeling overwhelmed, just think, what's the one thing I can do today? And there you go. Then go ahead and do it. And maybe it is letting go. Maybe it's getting rid of any crap that's in the cupboard, I don't know, sugary cereals, Pop-Tarts. Don't tell me they're in there. All right. Get rid of the heroin, so to speak. So get rid of the stuff that doesn't serve you, and focus on what does serve you and nourish you, both from the food we eat to the people we associate with, and to the thoughts that are entering our heads. So with that, I thank you guys, and I will see you tomorrow. Thank y'all. Thank you, Dr. Rahav.
Bye. Bye, Dr. Kabeka. Thank you.